There were so many moments where I knew I needed help.
Because I felt confused and like my life was spiraling out of control, I was doing whatever I could to try to feel some sense of control or safety.
All of the uncomfortability that I experienced as a kid and washed it away. The more I drank, the more it washed away.
Desperate for a diagnosis, but afraid to take the steps.
There's stigma of people with mental illness, but there's also stigma of receiving treatment.
You're kind of looked down upon societally.
The truth about mental illness.
This is a chronic illness.
From the perspective of those succeeding and struggling every day.
We can't stop other people from seeing us as they choose to see us.
Fox 43 explores the difference a diagnosis can make.
There's no shame in seeking help for mental illness, none.
The importance of lifelong support.
The individuals who are struggling are not bad people. We're just people who need help.
And what still needs to happen to truly silence the stigma.
My greatest hope at this moment is that we realize, as important as awareness is, that awareness is not our solution. My hope is that we have the courage to experiment and the mercy to allow people to try more than once.
Fox 43 is silencing the stigma and understanding the diagnosis. Thank you for joining us for this special edition of Fox 43 News, Silence the Stigma, Understanding the Diagnosis. I'm Amy Lutz. In this third part in our four-part Mental Health Awareness Month special, we aim to better understand exactly what those with mental illness are truly feeling. In these monitors are people who have experienced the highest of highs and lowest of lows of their diagnoses. One you may recognize as one of Pennsylvania's U.S. senators and former Lieutenant Governor John Fetterman. The other two are community members in South Central PA looking to make a difference by sharing their story. Right now, we are diving into their individual stories of their dealing with mental illness and their life after treatment. As we mentioned, Senator John Fetterman has publicly shared his struggle with depression. Fox 43's Harry Lee explains why his disclosure is still rare among elected officials and could help lessen the stigma surrounding mental health treatment.
Senator John Fetterman said in a recent interview with MSNBC's Joe Scarborough that he's begging anyone struggling with their mental health to get treatment.
And he did say treatment works.
The remarks come a month after Fetterman was discharged from a 6-week stay at Walter Reed National Military Medical Center in Bethesda, Maryland. His admission there for clinical depression in February set off a national discussion about mental health.
There's no shame in seeking help for mental illness, none. And I think that was the message that came out from his admission to the facility.
That message still has not reached everyone in society.
When people think about asking for help, oftentimes they think, oh, people are going to judge me, especially in middle-aged white males.
White males account for nearly 70% of suicide deaths, according to the American Foundation for Suicide Prevention.
They feel like there might be judgment against them, that they're weak or they can't cope.
Health experts say that may be one of the reasons Fetterman did not seek help sooner.
Fetterman shared that he didn't know his symptoms were attributed to depression, and we see that a lot.
Fetterman's health was already under scrutiny after he suffered a stroke on the campaign trail. Voters still appeared to endorse his fitness for office, though, by electing him to the Senate.
Congratulations, Senators.
Mental health advocates say his mental illness should not be treated any differently than his physical illness.
They're clearly integrated, and I don't think can be treated separately.
Whether physical or mental, treatment is the key.
Fighting stigma and extinguishing stigma is a long-term goal because it stops people from seeking treatment. He probably has no idea how much good he did by being public.
Advocates say Fetterman's high profile could inspire others struggling with their mental health to get treatment.
I'm hoping that by Fetterman coming forward, he will use this platform to promote mental health and treatment, and I think that's significant.
Senator Fetterman's team declined to comment for this story. Harry Lee, Fox 43 News.
As we have stressed before, access to mental health treatment is one of the biggest issues facing America's healthcare system right now. However, even with access to treatment, those with a diagnosis may be afraid to take the first step towards treatment for multiple reasons, whether it's discomfort with a provider or frightened feelings over the stigma of receiving treatment.
Finding an auto mechanic that you trust to repair your car is difficult, right? The barriers to finding somebody that is a mental health professional that you trust, that you'll open up your heart and soul, the deepest, darkest secrets to, that's a pretty tough hill to climb.
Reese Butler, the creator of what's now known as the National Suicide Prevention Lifeline, says that while not all mental illnesses are created equal, they're oftentimes treated that way. Insurance companies tend to put a cap on the amount of visits covered to a counselor or therapist. He says there's a step people can take in order to help out a family, friend, or coworker in need.
Anyone can learn a basic gatekeeper training program like QPR, Question, Persuade, Refer. It takes 1 hour. It can be done for free or maximum $29 online. Many people know CPR and never get to use it. I guarantee anybody who's willing to spend 45 minutes and learn QPR, they will get to use it.
Butler stresses QPR is not a replacement for treatment, but it is a resource anyone can use in a pinch to help someone who may be facing a mental health crisis. Life before receiving treatment can be difficult. And really, not only is each illness itself different, everyone's individual experience with the illness is as well. So tonight, we are introducing you to community members diagnosed with mental illnesses who have worked their way out of that darkness. Louis Bianco has been struggling with his mental health since he was 15 years old and was diagnosed with bipolar disorder. Christopher Dreisbach has been on a path he says led him to addiction since he was just 13 years old. Both of these incredible men sat down with me to tell us what life was like before they got help.
It's sensitive. Out of the rest of my siblings, my feelings were hurt more easily. I would cry more often. I would say medication started when I was hospitalized for the first time my junior year. So that would have been around 2000, 2001. I was receiving things like therapy and outpatient treatment. When the 9th grade piece started, I was in the guidance counselor's office a lot, but once I had what I would call my first episode, that's when the medication started, and I started to go into the lockdown psychiatric facilities, and everything really started to plummet.
So my experience with addiction started when I was 13 years old, and I went to a family wedding, and I saw a lot of the adults drinking and having a good time, and I also kind of was 13 years old and very large and growing facial hair, and I kind of went up to that open bar and I started drinking. And what happened for me was it took all of the uncomfortability that I experienced as a kid and washed it away. And from 13 on, I really constantly chased that feeling, and I had to move on to the next level of substances and the next level of substances and the next level of substances until I landed on heroin at 17, and that took me way, way, way off course.
They had so many, before we really nailed it down to bipolar and PTSD, they said I had traits of obsessive compulsive disorder. It was at one point major depressive disorder and generalized anxiety disorder. They saw borderline personality disorder. I was manipulative. In the mental health field, there's somewhat of a hesitancy to diagnose something like bipolar at that early of an age.
There were so many moments where I knew I needed help, but I was unable to muster the brain capacity to make it happen, because addiction, substance use disorder, whatever you want to call it, is a brain illness, and it creates a neural pathway that blocks my ability to reason. So even though I know inherently I have a terrible, terrible issue, something that's really damaging my life in so many ways, I can't physically, emotionally, in any way handle that or push myself towards recovery, because I believe that this is my reality and this is the only thing that I'm going to deal with for the rest of my life.
There was a number of years early on where I somewhat expected it to go away. And in that expectation, every time it returned, there would be disappointment, high levels of disappointment. And in that disappointment, there would be dysfunction, and I would falter again and fail.
That's just the beginning of Chris and Louis's stories. Still to come, they open up about their time receiving treatment, as well as what life is like now living with their diagnoses. Stay with us. Silence the Stigma. We'll be right back. The step people struggling with a mental illness find daunting and sometimes even terrifying is admitting that they need help. Even if the resources are there and available, taking that first step to get treatment can be difficult. Chris and Lewis shared their experiences about getting the help they needed, even in unexpected ways, and their views on the stigmas attached to it.
When I was first hospitalized, my roommate was a 40-year-old who was receiving electric shock therapy. So there wasn't a teenage unit or a child and adolescent unit. Now we found one, but locally there wasn't initially. I was the only teenager on that unit. There were also some requirements and duties that I had to fulfill as a patient in order to have visitors. And because it was my first time being medicated, I wasn't always able to get the amount of points I needed, so then I also didn't get the familial support and get visitors.
The first time that I went to treatment when I was probably 18 years old, so the county of Lehigh paid for me to go to an old state hospital in Wernersville, Pennsylvania, with some very antiquated models of recovery. And by the time I got in, I didn't want to get clean at all, and it just turned pretty disastrous. And all the rest of my treatment experiences were through the criminal justice system, because unfortunately I continually ran afoul of the criminal justice system. When I was 18 years old, I got charged with felony burglary and criminal trespass because I walked into another person's house and took a needle.
But I'm 39 and I've had electric shock therapy, and I don't remember the majority of my life. And now here I am looking in the mirror, seeing a person that I wonder, like, how did I get here? So it's hope that continues to push me forward. It's something, it's hard to describe because it's abstract. And we want direct answers, we want concrete answers, we want the 30-day fix, we want the medication that works immediately. But if we go back to the concept that this process is so long, hope is literally that thread that keeps us hanging on during the moments of distress.
You're kind of looked down upon societally as a drug addict, if you will. And that's, neither here nor there. It just kind of is what it is. I was unable to maintain sobriety outside of jail, so my parole officer would repeatedly take me back to jail, and when I would get back out of jail, they would try their best to get me into another treatment facility, and on and on and on. It was a constant failure for me until finally a judge shipped me here to Lancaster County, where I was able to get involved with some support systems and local AA meetings, and I met a group of people who showed me a different way to live, which I haven't let go of in the last 16 years.
The stigma of being somebody with a mental illness, one of the major things I have learned and that I try to encourage others is that we can't stop other people from seeing us as they choose to see us.
We've also been telling you about Robin, a now 20-year-old who dealt with severe depression and anxiety for most of her teenage years. She told us about the moments she decided to start seeking treatment for her mental health issues.
I wasn't proud of who I was anymore. I wasn't the daughter that I used to be. I wasn't the friend that I used to be. I would look in the mirror and I didn't even see myself. I think when I realized relationships starting to decline and it being harder to get out of bed, that all played into it, definitely. And that's when my mom and I started researching Newport.
Robin says she ended up going to a Newport healthcare facility for a 3-month inpatient treatment program. Newport offers several types of treatment, from residential to outpatient. Officials with the healthcare network say not every case of treatment is as intense as Robin's. However, Robin says while she was scared to ask for help, she was even more excited for the outcome.
I'd said I was really scared, but I remembered walking through the doors and I was like, oh my gosh, I cannot wait to be the person that walks out of those doors in 3 months. And when that time came, it was the most unbelievable feeling in the world. I had felt more myself than I had in years.
Robin says if it wasn't for the caring nature of the staff at Newport, her recovery would not have been as easy. Newport not only has treatment programs for depression and anxiety, they also offer help with eating disorders and addiction. While those stories of receiving treatment are very personal, they're all too real for people dealing with a mental illness. However, there is power in asking for help and hope for a better future. Still ahead, we hear how life is post-treatment for Chris, Lewis, and Robin. Plus,
I couldn't separate from the monster long enough that I could calm down long enough. I want him to be controlled.
anxiety disorders are the most common mental illness in the U.S., affecting 40 million adults every year. However, only about 37% of those suffering receive treatment. Right now on Fox 43 Plus, the three-part Anxiety Nation series takes an in-depth look at an illness and why so many avoid seeking treatment for it. Again, you can catch that right now on the Fox 43 Plus for Roku and Amazon Fire devices. Silence the Stigma. We'll be right back. Once someone is diagnosed with a mental illness, the reality is they live with it forever in one way or another. Chris and Lewis share what life is like now as they move forward each day knowing that, with the hopes of letting others know they're never alone.
And, I think it was probably the weirdest part was crossing over. I probably used drugs and alcohol for 7 or 8 years of my life. And when I crossed that threshold past that, I think it was one of those kind of defining moments where, I already knew this was my life path, but I really felt it.
I've lost jobs, I've lost relationships. Sometimes it's been my own doing, sometimes it's because of preconceived notions. I appear too healthy to be ill, or I appear too ill to be healthy. And the perceptions of others, I'm at the mercy of it. But if I stop and say that's not fair, then the only progress I'm halting is my own.
I would say maintaining sobriety is not difficult every single day. If you feel like it's difficult every single day, look into some other programs, look into some other resources, look into some other supports, because recovery is not meant to be a doldrum, sad struggle and fight. Recovery is empowering. Recovery is strength. Recovery is power. Recovery is being able to walk amongst everybody else and feel like you belong.
My greatest hope at this moment is that we realize, as important as awareness is, that awareness is not our solution. I often compare it to the scientific method. As a nurse, we recognize a problem, so we start there, absolutely. Then we hypothesize what could be the answer. We take educated guesses, and at some point we have to start experimenting. And those experiments will succeed or fail, and if they fail, then we document what went wrong, what went right, and then we experiment again. So my books, for example, and the different music that I've written, all these different creative endeavors and speaking engagements, some of them succeed and some of them fail, but my hopes are that we start to experiment.
And the value of being able to help other people achieve sobriety and achieve a life that they really want to live is so multiplicative. There's really so many different factors that go into it. I mean, number one, every single time you help somebody, it inherently helps everybody around them, which makes the world a better place. So I like doing that. Not only that, but it helps me. I feel tremendous when I get to watch somebody go from eating out of a dumpster to having their own business.
Robin also has a message for anyone who may be struggling to take the first steps towards seeking treatment. She says her life drastically changed after those 3 months at Newport.
I know a lot of people before they go into treatment, they think, oh, I don't have time for that. Like, I have other priorities. But I really think that there's nothing more important than getting that help for yourself, because really when you take a step to the side and you look at the future, you have so many experiences yet to be had, so many people that you haven't loved yet, that haven't loved you yet, that you haven't even met yet, places that you haven't gone.
Thanks to her treatment at Newport, Robin is currently serving with AmeriCorps in Colorado and will be pursuing a bachelor's degree at Penn State in the fall. Thank you for joining us for Silence the Stigma, Understanding the Diagnosis. While we know a quick 30 minutes can't change everyone's perceptions, we hope that this has helped people better understand more common mental illnesses. And if you or someone you know is struggling with depression or suicidal thoughts, dial 988 or text 741-741. If you or a loved one is potentially dealing with an illness and is curious about treatment options, we have much more information available right now on our website, fox43.com. And be sure to tune in next week for the fourth and final part of our Silence the Stigma Mental Health Awareness Month special. Hope in Treatment highlights both up-and-coming as well as common treatments for the mental illnesses that we just talked about. We'll also take you to several businesses Chris helped get off the ground in order to help more people recovering from substance use disorder get back on their feet. Hope in Treatment airs next Wednesday at 10 p.m. on Fox 43. And Fox 43 News at 10 starts right after the break.